Hi everyone, welcome back to our channel. As parents, we know there's nothing worse than seeing our little ones under the weather. And let's face it, kids, especially the younger ones, seem to be magnets for sniffles and sneezes. Did you know that kids can catch up to 8 colds a year? That's a lot of tissues. In today's video, we're going to arm you with everything you need to know about managing the common cold in children with some effective home care tips. We'll cover everything from recognizing the symptoms to providing comfort and relief. Stick around to the end for a special bonus tip that you won't want to miss. Let's start by understanding what we're dealing with. The common cold is a viral infection of the nose and throat. It's incredibly common in children, especially during colder months. But colds can happen any time of year. They peak during fall and winter. Signs include a runny nose, cough, sneezing, sore throat, and tiredness. Every child is different, so symptoms can vary. Now, you might be wondering, why do kids seem to catch colds so easily? Well, it boils down to a few factors. First, their immune systems are still developing. Think of it like this: their bodies are still learning to fight off all the different germs they encounter in the world. Second, kids are by nature curious and hands-on explorers. They touch everything, and I mean everything. And unfortunately, those little hands often end up in their mouths or noses, which are prime entry points for cold viruses. Third, kids, especially younger ones, spend a lot of time in close proximity to other kids, whether it's at daycare, school, or the playground. And as we know, colds spread like wildfire in these environments, so it's not really a surprise that they get sick more often. As parents, we develop a sixth sense for when our kids aren't feeling their best. But sometimes, those early signs of a cold can be subtle. Besides the classic runny nose and cough, here are a few other things to watch out for. First, pay attention to their breathing. If your child is breathing faster than usual, or if you notice their nostrils flaring when they breathe, it could be a sign of congestion. Congestion basically means that the nasal passages are inflamed and filled with mucus, making it harder to breathe. Second, listen to their voice. Does it sound nasally or hoarse? This could indicate a sore throat, which is another common cold symptom. And lastly, keep an eye on their energy levels. If your usually energetic child is suddenly dragging their feet and wanting to nap more than usual, it's a clear sign that their body is fighting something off. Chapter 4. Congestion, when little noses get stuffed up. Let's talk about congestion for a moment because it's one of the most bothersome symptoms of a cold, especially for young children. Imagine trying to breathe through a straw. That's what it feels like when your nose is congested. Congestion happens when the lining of the nasal passages gets inflamed and produces excess mucus. This mucus is actually the body's way of trapping the cold virus and preventing it from spreading further. But while it's doing its job, it can make breathing a real challenge. Young children are particularly affected by congestion because their nasal passages are much smaller than those of adults. So even a little bit of swelling can make a big difference. Signs of congestion in children include noisy breathing, snoring, even when they're not asleep, restlessness, and difficulty feeding. Chapter 5. Soothing a sore throat. A sore throat is another common symptom of a cold that can really bring down your little one's mood. It's caused by inflammation of the throat, which can make swallowing painful and uncomfortable. You might notice your child refusing their favorite foods and drinks, or complaining of a scratchy or itchy feeling in their throat. They might also point to their throat or rub it frequently. While a sore throat is usually nothing to worry about, it's important to provide relief so your child can stay comfortable. Warm liquids like broth or herbal tea can help soothe the throat, while cold treats like popsicles can help numb the pain. Chapter 6. Dealing with the dreaded sneezing fits. The sneeze. It's the body's way of expelling irritants from the nose, but when you're in the throes of a cold, it can feel like you're sneezing non-stop. Sneezing is a reflex triggered by irritants in the nose such as dust, allergens, or in this case, the cold virus. When these irritants tickle the lining of the nose, it sends a signal to the brain, which then triggers a powerful expulsion of air from the nose and mouth, aka a sneeze. While sneezing is generally harmless, it can be quite forceful, especially in young children. In fact, a sneeze can travel up to 100 miles per hour. To help your child cope with sneezing fits, make sure they have plenty of soft tissues on hand. Fever is a common symptom of many childhood illnesses, including the common cold. It's a sign that the body is working hard to fight off an infection. When your child has a fever, their body temperature rises above its normal range. A mild fever, typically defined as a temperature below 101 degrees Fahrenheit or 38.3 degrees Celsius, is usually nothing to worry about and is often a sign that the immune system is doing its job. However, it's important to monitor your child's temperature closely and watch for any other symptoms. If your child has a fever along with other concerning symptoms, such as a stiff neck, severe headache, difficulty breathing, or a rash, it's important to seek medical attention right away. Now that we've covered the common symptoms of a cold, let's dive into some effective home care tips that can help your little one feel better faster. Remember, the goal is to provide relief from the symptoms and support their body's natural healing process. Think of it this way: you're creating a comfortable and nurturing environment where their little immune systems can do their thing. And the best part is, most of these tips are simple, practical, and things you can easily do at home. One of the most important things you can do when your child has a cold is to keep them hydrated. Their bodies are working overtime to fight off the virus, and fluids are essential. We lose fluids quickly when sick, especially with fever or congestion. Encourage your child to drink plenty of fluids throughout the day. Water is great, but you can also offer warm water with lemon and honey for children over 1 year old, diluted juice, herbal teas, and clear broths. These fluids help thin mucus and ease congestion. They also prevent dehydration, which can worsen symptoms. In our fast-paced world, it's easy to forget the power of rest. But when it comes to fighting off a cold, rest is just as important as fluids. Think of it this way: when your child is resting, their body can focus all its energy on fighting off the virus. Encourage your child to take it easy and get plenty of sleep. Let them skip their usual activities and just relax on the couch with their favorite book or movie. Create a cozy and calming environment for them to rest in. Make sure their room is dark, quiet, and cool. If they're having trouble sleeping due to congestion, try elevating their head with an extra pillow. This can help to open up their airways and make breathing easier. To summarize, managing a common cold in kids involves hydration, rest, humidified air, and comfort measures. Remember to watch for any worsening symptoms, and don't hesitate to reach out to your pediatrician if you have any concerns. Most importantly, know when to seek medical help. And here's our special bonus tip. Consider boosting your child's immunity with foods rich in vitamin C like oranges, strawberries, and bell peppers. These can help keep colds at bay. Thank you for watching. If you found this video helpful, please like, share, and subscribe to our channel for more parenting tips and health information. Stay healthy, everyone.